Okay, chapter 9, articulations. An articulation basically means joint. Articulation, which is the joint that form between two or more bones. Two or more bones articulate with each other. Usually it's two. The joint structure that we will discuss will determine how much you can move the joint, which is called the range of movement. The stronger the joint, the less mobile it is. There are different ways to classify the joints. Functional classification will depend on the range of the movement. Is it freely mobile, like shoulder, for example? You can move it in all directions. Or is it something like the elbow? You can move it in one axis only. Or something like the vertebrae or the pubic bone and so on. And then the anatomical organization. Okay. These names, you have to remember them, right? Synarthrosis. Synarthrosis. Synarthrosis are the immovable joints. And you will have to remember examples of each one of those. You have to remember the name. What does it mean? Example. So if I ask you, you should be familiar. If I tell you the knee joint, what type of joint is it? You need to tell me, is it synarthrosis, amphiarthrosis, or diarthrosis, right? So we will come to the examples. But basically, synarthrosis is immovable joints. Do we have joints that doesn't move? Yes. Sutures, for example. Can you move? I'm not talking about the babies. Can you move your two parietal bones away from each other in your head?
No.
Of course not. But is it considered a joint? It is, because the sutures is where one parietal bone meet the other parietal bone. Is it considered a joint? Yes, it is. Can you move it? No. No. It's an exception if you're talking about babies, because this suture is not closed yet. It's not calcified. I'm not talking about this. I'm talking about the normal adult. So synarthrosis is immovable. What fill this joint to make it immovable? Fibrous or cartilaginous tissues. So it's fused already, like the sutures. It's fused. You can't move it. Amphiarthrosis is slightly movable. You move it a little bit. And there is also fibrous or cartilaginous connections in between them, but they do not fuse. Do not fuse. So you can move it a little bit. Amphiarthrosis. Diarthrosis, dia means free. Arthrosis means joint. So diarthrosis means the freely movable joints. And these are the joints that move freely. And you call it the synovial joint. Why? Because they are surrounded by a membrane. We will come to the structure later on. But they are surrounded by a membrane that's called synovial membrane. And this is where the name came from. And we will subdivide those. So these tables can give you all what you need to know. And we have to remember this. Synarthrosis. What's synarthrosis again? Syn, fixed, fused. Arthrosis means joints. The fixed joints, no movement. Example, there will be fibrous or cartilaginous tissues in between. Example, fibrous connection, like sutures. Here is one parietal bone, here is the other parietal bone, and this is the joint. You cannot move it. Why? Fibrous tissue lay down in this, and it's fused. So this is fibrous. Gomphosis. Gomphosis is between the teeth and jaw. Normally, you cannot move your teeth, right? But is there a joint between your teeth which is considered like a bone and the mandible, for example? Yes, it goes like this. This is the mandible. This is the teeth. It goes like this. So there is a joint in between the teeth and the bone, whether we're talking about the mandible or the maxilla. There is. Can you move it? No. If you can move it, there is something wrong. You're not supposed to. It's going to fall down. But normally, it is immovable. And the connection is called gomphosis. There are some ligaments and a lot of things, but remember that it is fibrous tissue that's filling this. So sutured or gomphosis, this is one example, if there is fibrous tissue. How about cartilaginous? Do we have some joints that are filled with cartilage, so you cannot move it. Yes, there is synchondrosis, which is epiphyseal cartilage. Can anybody move his epiphyseal cartilage? Like this is a 12 years old boy or a girl. Can you move like the two parts, or like the humerus? Can you move this from this? Of course not. It is considered a joint. Why? Because this is the epiphysis and this is the diaphysis, and it's in between those two. It's a cartilage in between, but immovable. In this example, bone, it can be bony actually. This is the one example here, which is called syntosis. You need to remember these names. So if you see it in the exam, don't say it's too hard or I don't remember or something. You have to know this. Syntosis. I know the names are kind of complicated, but you have to remember it as it is. Syntosis. What's syntosis? One bone, and bone in between. That's fusing them together. So what happened here is the joint become one bone mass, or joint bone mass. Portion of the skull and the epiphyseal lines. What's the difference between epiphyseal plates or epiphyseal cartilage and epiphyseal lines?
Lines are after.
After what?
After you become older.
Right. Yes. This is after the cartilage disappear and you replace it with bone and just remain a line that you can barely see in the x-ray. So this is obviously after puberty, right? After 21 actually. So epiphyseal line, it used to be a cartilage, so you can take it in both of those. So epiphyseal cartilage versus epiphyseal lines. Epiphyseal cartilage is synchondrosis. There is a cartilage in between epiphysis and diaphysis. When this cartilage change and become bone, you call it epiphyseal lines. And some portions of the skull, I'm not talking about the sutures now, okay? Actually, the other bones used to be 2 or 3 parts. You don't see it much. If you focus much on the skull, you can see actually that the occipital bone and the temporal bone, you can see there is a little bit of a line. Looks like it was 2 bones or something they fused together. Okay? So this is called syntosis. Amphiarthrosis, on the other hand, this is slightly movable, little movement. And again, there will be fibrous or cartilaginous tissues in between, connecting them together, but it's connecting them, not fused. Does not fuse them together. If they are fused, that will be the synarthrosis. Amphi means slight. Amphiarthrosis, the slightly movable joints, little movement. Fibrous is called syndesmosis, like the ligamentum connection. For example, tibia and fibula. Can you move the tibia and fibula? There is a joint between the tibia and fibula, right? Do you remember how the skeleton looks like? So if I moved my feet like this, the tibia and fibula are sliding a little bit between each other. There is cartilage or fibrous tissue in between. In this case, it's fibrous tissue. There are ligaments that holding them together, but can you move them around? You can. Symphosis is cartilaginous connection, and the pubic bone is an example of that. You can actually move the 2 bones against each other if you're moving right or left or raising one, and you can actually do a little bit of a movement of your pelvic. There is a cartilage in between that's allowing you to do so, and it's just a little bit. And between the vertebral bodies also. Okay? So there is cartilage. Can you move it? Yes. You think, if I do like this, something like this, and you'll see, oh, this is freely movable. It's not. It's because it's a lot, it's many, 24 vertebra, and there is a joint or there is a cartilage in between those, so it's adding up. But if you look at 2 vertebrae only and try to move them, it's very little movement. Don't consider this. This is freely movable. I can freely move. No, you're adding up all these joints, but one of them only. Hold 2 vertebrae only and try to move it. Very little movement. The whole movement of the vertebral column, this is something else. It's adding up all of this together. Diarthrosis now, this is the freely movable one. This is the one that's actually freely movable. 2 bones that have joint in between, and you can move it in different directions. And depending on what type of direction that you can move it, we will subdivide them. But generally speaking, the diarthrosis, which is freely movable, these are the joints that have a capsule and have a synovial membrane covering them, and there is a fluid inside. Okay, if you can move it in one axis only, it's called monoaxial, like this. If you move your elbow like this is one axis. Can I move it side to side? Can I move it anywhere else? Just this, right? So this is called monoaxial. Biaxial is like the rest and the ribs. So I can move it like this. Here is one, and here's the second, right? So this is biaxial, transverse and anterior posterior, right? Two axes. This is called biaxial, and you can move the ribs same way. Triaxial is only shoulder and hip, and this is where you can move it in all directions. I can move it like this, right? I can move it like this. This is two, and I can move it like this, right? Freely movable. Triaxial, all axes. And this is basic. And the shoulder, same thing. You can move your lower limb all directions, right? Out, in, anterior, posterior, circumference, right? You can do circumferential movement, and so on. So this is called a triaxial. The structural classification is, it can be bony, fibrous, cartilaginous, or synovial. Okay, so this is just taking the same thing but the other way around. And you need to be familiar with this. Not necessarily, to be clear, I will ask you what's syntosis. It doesn't go like this. Well, what's amphiarthrosis? Freely movable. Give me an example. Elbow. No, it doesn't necessarily go like this. I can get it the other way around. Okay? So I can ask you, which of the following is fibrous joint? Or gomphosis? What type of joint is it? So you have to take it both ways. Is that clear? You don't program yourself to just take it as it is. This is how we don't do good in the exam. That you program yourself. He's going to ask me about what's amphiarthrosis. I will tell him it's freely movable. Give me examples. It's elbow or shoulder. No, it doesn't go like this. You have to understand, not just take it as it is. It can't go the other way around. So this is basically explaining everything again that we covered in the table, so I'm not going to spend time in this. So in this part, if you do the table, that you're covered. But memorize it, the whole thing, and take it both ways. That will cover you. Now, synovial joints. We will need to know a little bit more details about that. Beside the fact that this is amphiarthrosis, or diarthrosis, and this is at the end of the long bones. And by definition, I don't know if you remember that or not, the long bone is not necessarily long. So you can say long bone, yes. Like humerus is a long bone, yes. Like tibia, like radius and ulna, yes. Femur, yes. How about this? These bones. Oh, this is not long, of course. No, it is. Long doesn't mean long. Long means the axis is longer than the diameter, for example. It's not short, it's like this. These bones in here. This looks like cubicle. So it doesn't have length. It doesn't have medulla. It doesn't have a cavity inside. So even this, the phalanges, the phalangeal bones, this is considered long bone. Long bone doesn't mean long. Long bone means it has an axis and it's longer along the axis and it contains medullary cavity inside. Did you get the definition? Don't confuse it and say that it's short. It's not. Short means it doesn't have an axis. Okay, so articular cartilage is padding these joints, and there is a fluid inside the joint to lubricate and make the friction, make the movement easier. Synovial fluid also supply nutrients. So inside your knee, for example, there is, the knee is the end of the femur and the beginning of the tibia, right? At the end of the femur, there is cartilage covering it. At the beginning of the tibia, there is cartilage covering it. So those two will not make friction with each other because the cartilage is smooth from one side, the other cartilage is smooth, and you also have a fluid in between to lubricate and make the movement easier. And the explanation of older people, they will say, I constantly have pain in my knee. I don't know what's happening. I didn't have an accident. Nothing really happened. I just have knee pain all the time. Where is it coming from? Where is it coming from? This is the osteoarthrosis or osteoarthritis or degenerative joint disease. Basically what's happening is, if you look at this, this is one bone, and here's the other bone. Okay, there is cartilage, smooth cartilage here, and fluid in between. This is normal, okay? This is smooth movement. Cartilage, smooth, cartilage other side, smooth. You have fluid in between, which is a synovial fluid in between, so you're fine. But later on, specifically those like who exercise a lot vigorously or play a lot of sports or something, especially something like football or soccer or something more than normal, you're too rough, you're going to erode the cartilage here. This will be eroded, it will become rough. So instead of two smooth surfaces in friction with each other, this will become rough, this will become rough. Every time they move, there will be some sort of rough friction between the cartilage that started to erode. And actually, it can disappear altogether. The whole cartilage is gone. And this is bone by bone. This is horrible. If it reached to that extent, no cartilage here, no cartilage there, and bone is in friction with the bone, that will make severe pain, and this is the point where they might need something like knee replacement or something like that, if it is that severe. Usually it's not that much, it's just the cartilage starts to be lost a little bit, eroded a little bit, so there is some friction and painful. But if it goes beyond that, this is another problem. Why do we have the synovial fluid? Lubrication to make the movement easier, but it also supplies nutrients. Because the cartilage, if you still remember when we talked about the tissues, the cartilage is avascular, just like the epidermis. There are no blood vessels in the cartilage. How can you get your nutrients then? Synovial fluid. Shock absorption as well. Okay? We have some accessory structures that keep everything in place. And I think we have a picture to cover this. Yeah, if you look at this picture here, this is basically giving you all accessory structures. This is the femur, and this is the tibia. This is the cartilage I was talking about. See this? This is the one that starts to erode in osteoarthritis. And here is the other one. So this is called the articular cartilage. Okay? You have fat pads. You put one here, one here, one here, one here. You put these pads all around, surrounding the joints to make it easier to move and to absorb the shock. Okay, so this is the second thing. The third thing is you have another type of cartilage that's called meniscus that goes in between the end of this bone. It's not in all joints, but I'm talking about specifically the knee now. So there will be meniscus here and another meniscus here, which is another cartilage. So this is the femur, and this is the tibia. Cartilage here, smooth. But you also put a meniscus, another cartilage in between like this and this, to absorb shock even more. And this is where we hear about people like playing something, football or something. I got meniscal tear. You ever heard about this? Specifically males, if you heard about this more? Yeah. Meniscus tear. What happened if you twist your knee like you're trying to go this way and then you change your mind and you twist like this, you can actually tear it. because it's in between the two bones. This is one thing. The other thing is it is surrounded by synovial membrane. There is a joint capsule and there is a synovial membrane. There is also some ligaments intracapsular to connect these. So a lot of things will participate to make the joint strong from one side and to absorb shock from the other side. There is also something called the bursa. The bursa is like a burst. It goes like this. This is the synovial membrane that's covering it, that's covering the joint. So pieces of this synovial membrane will go like this. Put fluid in, another one like this. And these are called the bursa. And you put it everywhere just to work like the fat pad. So you are trying, because this is carrying the weight of the body, and so you're trying to make the movement smooth and to make it ready to absorb shock. There are some ligaments as well. If you look at this is the patella. Okay, this is the tendon of the quadriceps muscle, which is this muscle, the muscle in front of the thigh. And there is a ligament that attaches the patella from one side and the tibia from the other side. So these joints surrounding will make it even stronger. More than that, there are muscles. You look at these muscles here, and this one, surrounding the joint. So if you put all these factors together, the movement is smooth, the joint is strong, and you can absorb shock. This is the whole structure of all of these together. So you have tendons, cartilage, we talked about it. There's articular cartilage, and there is another type of cartilage called meniscus. There is a fat pad to absorb shock, ligaments to stabilize the joint and make it stronger. And here come one thing that's called sprain. Sometimes you're playing any type of sports and you're injured and you go to the doctor. Sometimes they tell you you have a fracture and this is in the bone. Sometimes you have fissure and that's in the bone. And sometimes you call it, no, don't worry, you have just a sprain. If you ever heard about this, you have a sprain. What's the sprain? The sprain is not in the bone. The sprain is partial tear of the ligament. So this is a ligament that's holding these together like this, okay? This is a ligament like this. If part of this started to tear down like this is called sprain, okay? Are we following so far? This is called sprain. So sprain is a partial torn fibers of the ligament. It's not complete. If you cut it down altogether, this is called ligament tearing of the ligament. It's not cut. You just, because of overstretching it, you lose part of the fiber. So this is partially torn collagen fibers. Tendon, this is the attach of the muscles to stabilize the joint. Bursae is pockets of synovial fluid. Synovial membrane, put it like pockets, a lot of pockets, and spread it around to decrease the friction between the tendon or ligament with the joint. So if you look at this picture here again, look at this bursa, for example. Look at this one. Why it is here specifically? Because if it is not here, the muscle will have friction with the bone, or the ligament from outside will have friction of the bone. So anytime you have a ligament going like this to the bone, you put a bursa so that it does not have a friction, whether tendons or ligaments. So all of these together will stabilize the joints, as I mentioned: tendons, ligaments, muscles, bursae, fat pad, the capsule, synovial membrane, the ligaments, the menisci, the cartilage. All of this will add up together to make the joint stronger and stable. Okay, now another two problems that can occur in the joints. And remember that this is also important. We talked about fractures. Fracture is a fracture, it's a complete fracture. Or sometimes it's a green stick, this is an exception. Sometimes it's just a fissure. Still, we're talking about the bone. Now, we're talking about the joints. What can happen to the joints? Sprain is partially torn collagen fibers of the ligament. Dislocation versus subluxation. This is something else. Did you ever see somebody having dislocated shoulder, for example? Specifically shoulder, it can easily dislocate. Okay? Why? Because if you remember from the bone, this is the head of the humerus, and this is a glenoid cavity. This is too shallow. So it goes like this. So this is shallow, it's not like this, like the lower limb. Do you remember how the head of the femur fits inside the acetabulum? This is too strong. It's ball and socket. This is a socket and this is a ball and goes all the way in. So it's too hard to remove it, but the shoulder is like this. So it's very easy to detach. The most detachable joint in the whole body, shoulder. And if you look at it from the other side, this is the most freely movable joints in the body. Can you move any other joint in the body more than the shoulder? Think about it. Do you have any other joints that's easy to move or free to move more than the shoulder? This is the most freely movable joint, and that's why it's more exposed to dislocation. Okay, so if the joint removed or forced out of position, like you see the shoulder joint, the bone, this is the head of the humerus is moving like to the back, to the front or up. Okay, this is dislocation. How about subluxation? Subluxation is a partial dislocation. So it does separate, it's forced out, but that doesn't go anywhere. Stay as it is. Okay, so it goes like this. This is the normal, all right? If it goes like this is called subluxation. If it goes like this is dislocation. Did you get the difference? Some people actually, I saw that with some people, and sometimes I saw it with patients. Some people have the ligaments too loose or too lax, very flexible. So they actually, I saw that by myself. Some patients come having a dislocation. I can show you how I do it. And he do it like this and put it back. Okay, the ligaments are too soft. And this is something else, that's not normal. Okay? Not to the extent of you just pull it and put it back. It shouldn't be that easy, even if you have a dislocation. There is a way to do it. You have to pull first, align, and then put it back. Okay, so this is dislocation versus subluxation. So we talked about the plan, mono, bi, di. Types of movement. The movement can be linear, which is gliding, something like this. Okay, this is linear, you're going along the line, gliding. This is one. And in this part, what I want you to know is examples. Give me an example of linear movement, gliding. Give me an example of angular. Give me an example of circumduction. Which joint can do circumduction? So angular movement, this is just a regular movement that we all know. Angular, like you go like an angle, like this. This is your angle, okay? The angle is obtuse like this, and you can do it like this, acute angle. So this is your angle. This is angular. Circumduction is like if you're trying to draw a circle, like this. And this can be done by shoulder and hip, right? Can you make a circle with your foot? You can. Can you make a circle with your hand, with your shoulder? So you can do it with the hip and with the shoulder. Try it. I can make a circle, right? So yes, circumduction, these are the two. Rotation is like this. You rotate around the axis. This has nothing to do with the angle. This is angular. This is rotation. Okay? So what's the example of, again, Linear movement, gliding. Give me an example. Carpal and tarsal bones. These little bones, they glide on top of each other. These are the two small bones. They can do like this. They can like make an angle or anything else. They just glide. So this is linear movement. Example, carpal and tarsal bone, the little bones of the hand and foot. Flexion, extension. Okay, this is more of a lab. So again, if I wanted to ask you about this, I would ask you about the example. So give me an example of the angular motion, most of the joints. Elbow, wrist, anything else. Flexion, extension, I think we're familiar with this, are we? Flexion, what's the flexion? What's the extension? Hyperextension, right? What is this? Look at my wrist. What movement is this? Flexion?
Yeah.
And what is this? What is this? Hyperextension. Are we familiar with this, or should I go through it?
Go through it.
Okay. Angular movements. What type of angular movement can we do? If this is the joint, okay? When you reduce the joint, decrease the angle, like this is this 180, right? It's line. So let's say this is 150, 140, 90, right? I am reducing the angle and getting the two parts closer to each other, or look at this. Here is one and here is one. This is almost straight line. So I'm going to reduce it. Looks like this. 180 or 170, 150, 30, 90, right? 60, 40. So I'm getting the two components closer to each other and reducing the angle. This is called flexion. The opposite, I'm increasing the angle and getting the two components, which is in this part, it is the arm and the forearm, or the humerus versus the tibia, the radius and ulna. So this is called extension. Okay, I can do hyperextension here, but look at this: flexion, extension. So extension, you go back to the normal position, which is a straight. How about this? Hyperextension. So when you extend beyond the line, the line of movement, when you extend beyond, this is called hyperextension. Look at this. This is flexion of my vertebral column. This is extension, right? How about this? Hyperextension. Okay, so this is what I was just talking about. Abduction versus adduction. I'm almost done. Just give me a minute. To remember this, add and ab. Adduction, meaning you add to the middle line, like this. Look at this movement. I'm going to adduct my upper limb. Adducting, adding the limb to the body. Versus if I'm going to abduct it away. Abduction. When you abduct something, meaning you take it away, right? When you abduct somebody. So I'm abducting away. So this is adduction and this is abduction. Okay. So what do you call this? Look at my fingers.
Hyperextension.
No, fingers.
Extension.
Okay, this is another movement. Where is the angle? Where is the angle of this? Its angle is here. Did I do like this? So it's not flexion, extension. Okay, you have a middle line for everything. If you move away from the middle line, this is called abduction. You abduct away from the middle line. Where's the middle line? It's right here. Okay? When you add, like this is adduction of the fingers. Abduction of the fingers, adduction of the fingers. It doesn't look like this, I understand. But it's just a concept. Take the concept, understand it. There is an axis. There is a middle line. You move away from the middle line. You abduct away from the middle line, abduction. You add toward the middle line. This is called adduction. And we will stop here for today.